Morning, and welcome to the Federal Communications Committee. For some of you, these are familiar conference rooms. For others, it's the first time you're here, and I'm really pleased by both the breadth and the depth of the people we've assembled for this very important discussion today. We have physicians here, entrepreneurs around mHealth, and people from different parts of the governmental landscape that touch on both health-related policy and technology and communications technology policy. I'm not going to acknowledge everyone in the room because that would take the whole morning, and I'm going to come back and talk a little bit about that. But I do want to acknowledge a few people who have been working very hard and making tremendous contributions to harnessing the vision we all have of putting communications technology to work in a way that will improve healthcare outcomes, lower costs. Secretary Sebelius at HHS has been a terrific partner. Peggy Hamburg from the Food and Drug Administration has also been a terrific partner. NIH, the Department of Veteran Affairs, CMS, all the agencies. I think one of the things that I'm so pleased about is that we've been able to get cross-governmental collaborative discussions going, both inside government, between the government and private sector. It's very, very important, and it's not easy. And so I do want to thank the staff here at the FCC who have been focused on doing this. Josh Gottheimer, who's sitting here, Julie Knapp, Jordan Usan, Maya Upaluru, Kevin Almaty, Roger Goldblatt, Cheryl Ismail, and Kyla Hernandez. It's very, very important work. If we all just stay in our own silos, we'll be leaving opportunity on the table. Let me introduce the discussion today by asking and answering two questions. One is, why have we gathered some of the nation's leading mHealth experts at the FCC? And the second, why have we gathered some of the nation's leading mHealth experts at the FCC? But seriously, the first question is, why the FCC? We're hosting the event here because we are the agency that's focused on communications technology, harnessing the benefits of communications technology to benefit all Americans. That's what we do. That's what our expertise is. And across the board, we have organized the agency to drive broadband deployment, adoption, to promote innovation. And one of the things that we have found is that these technologies are disrupting, affecting a whole series of very important verticals, creating both new challenges and tremendous new opportunities. And none of those verticals is more important than healthcare, than the medical vertical. And in fact, as everyone here knows, new information technologies offer incredible promise for our healthcare system in the United States. A smart pill box can send automatic reminders to a patient to take her daily medication and alert her physician or family members if she skips it. New mobile diabetes management devices are freeing patients from the burden of logging their glucose measurements and making remote monitoring a seamless process. And since I've become chairman in 3 years, together with this incredible team, we've been working to harness the power of communications technology to improve the quality of healthcare, lower costs, and save lives. We began in 2009 with our country's first national broadband plan, which identified healthcare as an area of enormous opportunity for broadband-enabled innovation. The plan included many recommendations which we have been implementing. As recommended by the broadband plan, we entered into an unprecedented partnership with the Food and Drug Administration, the first MOU in either of our histories that talks both about driving innovation while preserving safety this partnership has gotten off to just a great start. We have people here from the FDA, and I wanted to thank them for their energy in working with us to accelerate the introduction of new technologies that can improve health into the marketplace. In November 2010, we opened a proceeding to examine ways to promote innovative and efficient spectrum uses for wireless healthcare devices. Today, I'm very happy to announce that the FCC will act on our proposal to create new experimental licenses for medical and other research. This will reduce regulatory barriers to introduce new innovative healthcare products. It will cut red tape, speed the process of getting new technologies into the marketplace, particularly, of course, these spectrum-based technologies. These new streamlined experimental licensing processes will also be created for universities and nonprofit research institutions. This is something we're looking forward to doing. I want to thank Julie Knapp for developing this idea and working with all of you to bring it to the point where we can move forward on it. Some other things that we've been working on in this area: last November, the Commission dedicated spectrum for medical micropower networks. These are amazing technologies, spectrum-based technologies that literally have the potential to help paraplegics stand and walk. We have someone here from the Alfred Mann Institute, and the work that's been done in this area is just tremendous. We were very pleased to take the steps that we could take to accelerate the introduction of these technologies into the market. We continue this work. Just a few weeks ago, we adopted new rules to allow greater use of spectrum for medical body area networks, or M-band devices. For those of you who aren't aware of this technology, it's a spectrum-based technology that will untether patients from the cords that connect them to monitoring devices. And so imagine a patient in an ICU or elsewhere in a hospital with sensors that are recording all the information that healthcare professionals need, but without being roped down in ways that none of us particularly want. So this also is a very exciting technological development. Philips and GE spearheaded this, and thanks to the great work of our team at the FCC, we were able to work through some difficult technical, challenging interference issues to authorize the use of this spectrum in a way that, along with the many other things we'll hear about today, will help revolutionize the provision of healthcare both in hospitals and at home, because this technology will work at home as well. So this brings me to the second question. The first is, why at the FCC? The question is, why all of you gathered here in one place today? To unlock the benefits, the opportunities of communications technology for healthcare, if we all work in our own silos, we won't be maximizing the opportunity. It's true across government. It's true between the government and the private sector. And it's also true among different elements of the private sector involved in health, medicine, communications technology. And we have found that convening a group of committed experts in an area like this to identify the opportunities, be concrete about the challenges, work together to turn the great visions that I am sure every single person in this room has into reality. Well, that's our goal in convening this. We have expertise here at the FCC. We know that that expertise isn't alone enough to make this happen, and I think it's probably true for every single player at the table. The other, we have so much to talk about in these areas. You know, innovation is incredibly exciting. One of the reasons we want to bring this group together too is because I think we all share the view that innovation in and around communications technology and healthcare and medicine promises enormous benefits, but that the goal isn't innovation for its own sake. Duke Emanuel had a piece in the New York Times a couple of weeks ago that many of you saw. He made a point that's pretty obvious, but of course putting on the table, which is that just because there is a new product, a new technology, a new device, it doesn't mean that that will actually meet the goals of improving outcomes and saving costs. And he encouraged us in that piece to focus not just on innovation, but on innovation that, in a measurable way, improves outcomes and lowers costs. And that's something that we want to talk about today as well. I want to get to the discussion, and so let me just do a couple of things to set up how we're going to spend the next period of time in this room, and then beyond that. I'm going to tell you now that I want to dispense with the practice of going around the room and having everyone introduce themselves, because I'm going to come back at the end of the discussion and go around at the table and ask each of you to tell us what the one thing you would recommend that we can do that would have the most leverage in accomplishing our goal of unleashing the benefits of mHealth. So I'm telling you that now, but that's what we're going to do at the end. During the discussion itself, we want vibrant engagement. You have in front of you seating charts, and I think you've seen everyone else is here, so you all know who you are. I want to jump into the discussion. Josh Bauheimer, I've asked to moderate. I want everyone to be active in this. But the second point I want to make before we get going is that I do want to come out of today's session with some concrete, actionable ideas on steps we can take, barriers we can reduce, things that will change the world soon. But this isn't going to be the last part of this process. And so while it's an important day, it's critically important that we continue the work that we're going to do. So I'm going to ask you to agree to continue to develop the work that we talked about today. Specifically, I'm going to ask that this group deliver a short list of recommendations that come out of ongoing discussions that we'll have after this on what has to happen to accelerate the adoption of mHealth technology in the United States. I want this group to become an operating group that will move this forward, help the country seize the opportunities of wireless health technologies that can save lives and lower costs. I've asked a few of you to help lead this effort and to make sure that what we do here today continues. And I want to thank Robert Barron at Qualcomm and Doug Trauner at the Parrot and Dr. Julian Goldman at CIMIT who've agreed to work as a group just to make sure that the whole group can continue effectively so that we can make the biggest difference. So thank you all for coming. I appreciate it very much. I thank you all for the work that you're each doing at the various government agencies, as entrepreneurs, as healthcare providers. Looking forward to the discussion. I'm going to ask Josh Bauheimer now to get the discussion going. Josh is, as you'll see, a tough taskmaster. The team has put a lot of thought into categories of discussion. And so Josh is going to try to take us through a series of categories, stick to a schedule. We're not going to be able to touch on everything today. There's some things we may want to save for the lightning round at the end. There's some things that if you don't have a chance to raise today, we will make sure that there's